Our lifetime risk is 1 out of 10 of developing a kidney stone. If one has had a kidney stone, you have a 50% chance of having another kidney stone in the next 5 years. There is a large majority of stones which are small enough to pass through the kidney pipe from the kidney to the bladder. Stones, however, that are too large, that impact, can cause pain, damage to the kidney pipe, and damage to the kidney. The management of the stones is dictated by the size of the stone, the location of the stone, the hardness of the stone, and then individual patient factors. The least invasive procedure is an extracorporeal shockwave lithotripsy, which entails the focusing of shockwaves through a water bubble onto the kidney through the skin. This procedure is primarily used for stones which are located in the kidney. Majority of times it is stone that is small and which is not so hard. The stone fragments or the stone is shot into fragments, and those fragments would then pass via the kidney pipe. There is immediate post-operative pain. The procedure is principally done as an outpatient procedure where one would go home the same day or after a period of 12 hours observation. One can expect bleeding in the urine, and one can expect intermittent episodes of pain, and the use of prescribed medicines will control that pain. The expulsion of all the stone fragments can, however, not be guaranteed, and one would see your urologist again within a 6 weeks period to document if all the stone fragments have passed. When a kidney stone is located in the kidney pipe, we use a combination of a rigid urethroscopy and a laser to fragment the stones and then mechanically remove the stone with a small grasping device or basket. The access to the kidney pipe is, however, limited to your own anatomy. In situations where one is concerned that there is either damage to the kidney or damage to the kidney pipe secondary to the stone or the procedure itself, your urologist may decide to place an intraluminal JJ stent, which is a silicone tubing which stretches from the kidney down the kidney pipe into the bladder. That stent is normally left in situ for at least 7 days and can be removed in the rooms, or if necessary, a secondary procedure in theatre to have the stent removed. The most invasive of the smaller procedures is a percutaneous nephrolithotripsy. In this procedure, direct access to the kidney is achieved by placing the camera directly through the skin into the kidney. It is an invasive procedure which does carry a significant risk of damage to the kidney, as well as a significant risk of infection. For that reason, before the procedure is done, one would stop all medications which has a blood thinning effect. One will need to be sure that there is no infection in the urine, and all patients are started on antibiotics at least 48 hours before the procedure in an effort to prevent infection secondary to organisms being expelled during the stone fragmentation. The procedure entails placing a needle directly into the kidney under radiological guidance. A guide wire is placed, and progressively the diameter of the incision is enlarged so that a close to 1 centimeter size camera can be placed directly into the kidney. The kidney stone is then fragmented with a combination of either laser lithotripsy or an electrohydraulic or ultrasonic drill. These stone fragments are manually removed, and once the kidney is clear, a drainage tube is placed into the kidney. You would then go to the ward, and the following morning one would confirm with x-rays if all stone fragments have been removed and if there is no fragments in the kidney pipe. As a rule, one is discharged after 72 hours from the hospital. One can expect bleeding in the urine and pain in your side for at least 2 weeks. At any stage during any of the surgical procedures, if one would start experiencing excessive pain or fevers at home, you definitely need to return to the hospital.